Positional orthostatic tachycardic syndrome is basically what the word explains. So in essence, when patients assume an upright position, they get a reflex tachycardia, their heart rate increases, and it's often associated with lightheadedness and dizziness. It can cause a lot of other symptoms without a doubt. The heart rate response is one component of POTS, but that's a very simplistic idea of looking at POTS. And many patients, when they come to me, their first classic symptom they present is dizziness or awareness of the heart rate increasing on standing up. POTS it's also important to realize that POTS is a syndrome, it's not a disease, so it's a collection of symptoms. Dizziness, lightheadedness is by far the most common. Brain fog is definitely a big symptom that patients come with. They just can't really compute. They have problems formulating thoughts, etc. POTS can even have a more varied expression. It can affect the bowel system. So a lot of them may have dyspepsia or problems with their bowel habits. A lot of patients with POTS have urinary retention, so they come with frequency. And indeed, you get other symptoms such as headache and vestibular type symptoms get feed into POTS. So it's a broad collection of symptoms. There's two big groups of POTS. The biggest group probably is hypermobility type syndromes. So patients of Ehlers-Danlos type 3. So great cohort of patients that I see have probably had hypermobility for some years. And what I mean by hypermobility, they're just extra bendy. They often, some of them will have subluxations or dislocations of joints. And the reason how this causes POTS is that the vascular system is also more lax, and that results in the reflex tachycardia and all the symptoms. The other big subgroup of POTS is what we call post-inflammatory. This can occur after any inflammatory condition, viral or pneumonia, but definitely in the post-COVID era, COVID without a doubt is a big culprit causing patients with POTS symptoms, and I'm seeing them flooding into my clinic since the onset of the pandemic. So the first thing with POTS is obviously diagnosis, and for many years patients would be bumbling around in the abyss of medicine with no clear diagnosis. But more recently patients are coming forward, so at least we can get hold of them and do appropriate treatments. The diagnosis is generally done with this in a specialist POTS type service. The classic thing is that they look at is change in heart rate when lying to standing. Generally, it's greater increase than 30 heartbeats per minute would be a diagnosis. However, that's a very, and a lot of people get excluded with POTS based on that simple thing. POTS is a collective diagnosis, and when a patient comes into my clinic with POTS, you just get a feel that they've got POTS. They've just got the whole collection of symptoms: the dizziness, the brain fog, the increase in heart rate. A lot of patients have Fitbits, and that's generally how the diagnosis is made. And I definitely wouldn't exclude someone because their heart rate only went up by 25 beats a minute and not the magic 30 that a lot of patients use, a lot of doctors use. It's not a surgical condition by any means. It's a medically treated condition. The triad of POTS, it's part of the broader spectrum of autonomic dysfunction. So it's salt, fluid, and exercise are really the key. Those are the pivots of autonomic dysfunction. Getting patients salt intake adequate is often difficult, and we can supplement with slow sodium. Fluid intake is often poor. And then obviously exercise is key, and the exercise we recommend is rowing, prone cycling, or swimming. The other thing that a lot of people got wrong with POTS in the beginning is they just focused on the tachycardia, but POTS is a syndrome, and you often find that sleep disorder or migraine or bowel irritability or frequency with the bladder are peripheral features that feed into the POTS. So you need to address these peripheral features actually to improve the POTS. And that's where the art comes into POTS management.